Okay, there we go. Is it happening? Yay. I should turn my mic. Okay, turn my microphone on. Okay, my microphone's on. Okay, that's better. Okay. Now we are here for just 1 second. Hold on. Okay, we're here. So maybe I can read this shit out loud and knows what the hell it says. Because I know a lot of things, but my brain injury, I'm not sure about all the time because, well, things are always happening and I don't ever know what it is. So we're going to um find out about my brain injury. There we go. All right, here we go. Now I have what they time to drink water. Now I have an injury on my brain. It's called a shearing. It's when your brain splits in half. It's shaken baby syndrome. That's what it boils down to. I have shaken baby syndrome. I know that much, but I don't know what behaviors come along with that, and I have a lot of bad behaviors, and I would like to know. Uh, so this says it's a diffused axonal injury. That is the little things that are back there. Uh, the little things that are back there. Um, okay. So I don't know how to watch any of my chats when I'm doing this. Okay. Well, I don't know how to watch my chat. Yes, I do. I mean, I guess it really wouldn't matter because it's too early in the morning for people to show up. But just in case. But I doubt anybody's here. Um, right. Okay. So it's talking about the ventricles. I call them phalanges. So, but they're ventricles. Um, so that's what they're called. Now, it causes widespread, often microscopic tearing of the nerve fibers. Okay. That's what happened to my brain, leading to profound behavioral and mental health shifts, including aggression, mood swings, personality changes, and cognitive deficits. I have all those things. Patients frequently experience depression, anxiety, apathy, impulsivity, and social distabination, as well as reduced awareness of these changes. I have that. Okay. Then this is why I go to therapy, by the way. I have two therapists. Key behavioral and mental health impact. Here we go. Emotional vitality, personality changes. Patients may experience intense mood swings, emotional liability. I don't know what that word is. Sudden tears, anger outbursts, or flat, indifferent emotions. That's apathy, and that's what I have. I don't know how to be excited. That's what I have. Impulsivity and local destabilization, a decline in impulse control, leading to reckless decisions, inappropriate sexual behavior, or social and inappropriate remarks. I have that one. The inappropriate remarks. My impulse control was not good before my brain injury, but it's a lot better now. Aggression and irritability, increased frustration, agitation, or quick to anger behaviors. See, when people talk about being 0 to 100 real quick, it's like, I don't think you know what that means. Because you go from 100, I go from 100 to 100 real fucking fast. So, like, I don't think people understand what that 0 to 100 really fucking means. Because it's a terrible thing. Now, where was I? Inappropriate anger behaviors. Oh, yeah, quick to anger. Yeah, nobody knows what 0 to 100 means. Okay. Mental health disorders. High risk of developing depression, generalized anxiety disorder, PTSD, and substance abuse. I only smoke a lot of weed. So I guess that would be substance abuse. Now, all my therapists, they say I have this depression, anxiety, and PTSD. I don't think I have those things, but they said I have those things. Cognitive behavioral overlap, difficulties with memory. I'm getting my memory back like real fast. Attention and executive function often present as low motivation or anxiety, or mistakenly as laziness or bad housewife. I've always been a bad housewife, though. I'm like Peggy Bundy. It's just only Al doesn't give me his check. But I'm as good of a wife as Peggy Bundy. Reduced self awareness. A common feature is lack of insight into their own behavioral changes, making assessment challenging. Yes, I have that a little bit because I try to tell them about that other personality in my head and they think I'm having hallucinations. It's like I'm not having hallucinations. I literally have another me inside my head. It's very angry. Now, managing the effects. Can't manage these effects without medication. Which is stupid. I'm on so many fucking pills. Hey, Michelle, how are you? Let me put you up here on my phone so I can see better because I don't know how to put this up here. And I'm just going to put my phone right here so I can see you. Okay, that's going to be how it goes. Okay, so managing the effects. Apparently, you can't manage these effects without medication, but we are going to. Yeah, there we go. Treatment approach. Environmental and behavioral interventions are first line, followed by medication, mood stabilizers, and anti agitation agents. I wonder if those are sedatives because they have me on a lot of sedatives. Yeah. And then sometimes it's hard to sleep and I'm up at fucking 5:30 in the morning and now it's 7. I've been up for 2 hours. But I was listening to classical Czech preach. I was watching cast classical Czech, and then I was like, I couldn't stop thinking about my brain. So here we are. So again, I want to find out what an anti-agitation is because if that's a sedatives, those don't fucking work. Okay. So now it's support, social, emotional, cognitive support is crucial. Yeah, but what if like you get screamed at all the time? That's really good, right? That's social support. Screaming. Along with managing the frustration caused by these involuntary brain-based changes. Oh yeah, no. If you don't look injured, nobody thinks you're injured. It don't matter if your brain is broken, they'll still scream in your face. Causes. Brain shearing occurs um occurs when the brain rapidly rotates or shifts inside. This is the shaken baby syndrome part where your brain splits in half part of it smashes the back of your brain and the other part smashes the front of your brain. So it's like, yeah, and then your whole life changes from that moment on. It's all bad. But this says brain shearing occurs when the brain rapidly rotates or shifts inside the skull, tearing axons. Those are the little finger things. Uh, they're the little finger things that hook your motherboard to the rest of the computer. So it's like your on and off pull pluggy thing. And sometimes when those get broke, you get fucked up. Or if all of them break, you end up being a vegetable. Thank God that wasn't me. Okay. So it tears the little axon things, often resulting from high speed car accidents or violent shaking, or getting smacked in the back of the head off your bike and then hitting the cement with the front of your head. It is a thing that happens. Um, Resulting from or violent shaking. These injuries might appear, they might not appear on standard CAT scans or MRI scans. Oh, wow. Man, my brain is so complicated because there's way more injuries that I have in my brain. But this crazy. Okay. Mental health consequences of traumatic brain injury. It's associated with a variety of mental health problems. These problems include, how do I, okay. Okay, this is not a thing. Okay. Anyway, okay. Adult TBI. Where the fuck was I? Was it? Okay, right here. Adult traumatic brain injury for mental health professionals. What? Okay, here we go. I just want to read this one paper. Just if you shut up and let me read it. Wow. Why is this so okay? That's not the one. Right here. What social, emotional, and behavioral changes can be seen as a result of the brain injury and for whom? Aw, thank you. Okay. This is gonna be mumbo jumbo, ain't it? Let's just find out. Okay. It wasn't this one. Right here. Social and emotional behavioral changes arising directly from the brain injury are most evident and are most evident in cases of more severe brain injuries, and the result from injury to brain tissue changes can include trouble filtering or restraining emotions or or thoughts one would normally avoid saying, feeling less patient, crying more. Okay, that I don't do because bitch wish I would. No. I don't do that crying shit. That's for other people. Wanting to isolate, having trouble with healthy decision making, feeling as if people are getting on one's nerves more easily. Bitch, I'm telling you, I wish I could. Dude, Dustin is so mean. There ain't no way. Mm-mm. He is so mean. Could you imagine if I was having a bad day? No way. Not even possible. Having um getting on one's nerves more easily and unusual social skills. Yes. Sometimes called orbital frontal syndrome. I don't have that, but I definitely have something wrong with my frontal lobe up here. Uh, Mood swings can occur in these cases. Brain injuries can also result in lethargy, mood, and difficult getting started or completing tasks. Yes, this can look like lack of motivation or decreased goal directed activity. See, that's why I told my doctor I need some Ativan. Like, I need some Ritalin. I need some something because I do not feel like moving at all. Oh, yeah, no. Listen, I got I got beat up a lot. Had this brain injury almost 10 years now, and we're just starting to figure it out. And we just found this stuff. But I got curb stomped. I got hit in the back of the head and then curb stomped into the dirt. Luckily for me, it was the dirt. They just smashed my face in the front yard. It was a thing. But I'm telling you what, I'm better now because of it. I'm better now because of it. Um, so sometimes mood swings can occur. These cases of brain injuries can also, yeah, because it's like I'm lazy. That's right. I just read this. And flat mood, getting started, lack of motivation. Yeah, because I said, can I have some Ativan? Depressed mood is a common outcome across severity levels of TBI. No, I'm not depressed. I don't know why everybody keeps saying depression is a part of this. You're gonna be crying yourself to sleep every night. It's like, no, have you met me? I am way too happy, but I'm happy and lazy. Here's some studies showing micro. Yes, yes. And we were gonna try that. But the one time I had mushrooms, I fell asleep for like 15 hours. So we put the kibosh on that because it didn't help anything. I just fell asleep. Sometimes depressed mood is a common outcome across all the brain shit. It can be very helpful for survivors to understand these as brain based changes when this is the case, and to note when changes are evident. What? It can be very helpful for survivors to understand these as a brain based changes when this is the case, and to know when the changes are evident. Okay. Emotional and behavioral problems can also uh, result from psychological denial of changes and or stress associated. Now, I might have that because, like, I don't like it. So I might have that one. Psychological denial of changes or stress associated with life changes following the injury. Some individuals regain awareness of their situation before they have developed emotional coping skills to cope with the loss of function, potentially exacerbating emotional and behavioral problems. Okay, I probably have that one. Hold on. What does it say? It can be very helpful for survivors. See, I don't know what this is saying. I don't think. Yeah. Yeah. But, I get uncomfortable doing drugs around other people because my experience with drugs and other people is I'm probably getting fondled, or it's gonna ruin my whole high because somebody wants to make out. And that's my own fault that my experience of drug doing is that. It's my own fault. That's what I get for hanging out with little boys and not grown ass men. So I try not to do drugs around other people. And then when I do, I immediately go to sleep. It's like I'm not even dealing with y'all. I just came for a good time. You guys came for some other time. I don't know. I'm just saying stupid shit, I guess. Let me read this one second. Oh, see? Now I would like to take a pill that does that to me. Oh my god. I would have the cleanest house on the planet. Going from the dirtiest house on the planet to the cleanest house on the planet. That might make Dustin happy. Uh-huh. Now I give Dustin a lot of shit, but he deals just fine with me, I suppose. Maybe if, yeah, I just went over here instead of on my YouTube. Okay. Wait, what is happening? Okay, let's see. Chronos can be very helpful for survivors to understand these as brain based changes. When this is the case, understand these brain based changes. When this is the case, and to note when the changes are evident. Emotional and behavior problems can result from psychological denial of changes and stress associated with life changes following the injury. That's what I have. That's the part I have because it's like I I don't have any of that when clearly I have all of that. But it's like I don't want to have all that because it's so much extra. And do you know how hard it is to fight to get a doctor's appointment? Because people are way too busy. Yeah, I don't have any of those problems when it comes to that. If you can't see me telehealth, I can't see you. I'm sorry. I'm not fighting for rides. Um, some individuals regain awareness of their situation before they have developed the emotional coping skills to cope with the loss of function, potentially exacerbating emotional and behavioral problems. God, I'm so fucked up. How did I get this fucked up, man? Don't answer that. Oh God. Okay. My Irish twin suffers from TBI. Yeah, I can't. I my tear ducts don't work, and it's real hard to even cry. It's hard to even get sad about things. Oh, yeah, that's way worse than what happened to me. Holy crap. That's crazy. All right. Let me go grab this cup of coffee real quick and we'll keep going. Dude, it's snowing outside right now. And it's snowing kind of fast, too. Yeah, it's snowing outside pretty fast. All right, let's keep going. Thus, the causes of emotional and behavioral changes are multiple and diverse and encompass neurological changes. We're in Ohio, but it kind of looks like it's Detroit outside. It's snowing so fast. But we probably won't get a foot of snow like we did the last time because it is kind of warm outside. I can't believe it's snowing. It was fucking 60 degrees yesterday. And it was supposed to be warm again today too, but now it's snowing. Okay. So the changes are multiple and diverse and encompass neurological changes that result um damn they result directly, is that indirectly or directly? Oh, directly from the energy to some of the brain areas where emotional and behavior regulation is medicated. What does that even mean? No one even knows what that means. The causes of emotional and behavioral changes are multiple and diverse and encompass neurological changes that result directly from the injury. So that's the smacking and the hitting. Okay. So that is also a problem, I guess. Regulation is medicated, such as the limbic system and frontal lobes. Yeah, my frontal lobe is messed up. That's why I got hemiparesis. Uh, Emotion, medicated frontal lobes, as well as pre injury factors, coping style, which I have none, uh, and post injury factors, such as difficulty adjusting to functional limitations. Look, the first time I ever remembered I was crippled was at a restaurant and I ordered something and I went to cut my food and I couldn't because my hand's not strong enough. I had a meltdown in the middle of the restaurant. I don't want to be crippled. It's a whole thing. Hmm. Yep. Dustin got so mad at me. It's like, but I can't help it. I don't want to be this way. Okay. Factors such as adjusting to functional limitations, limited availability of social and health system support, or any combination can be present. Yeah, I have no social system support. My family could give a fuck less that I'm injured. Oh, so is it snowing there too? It probably snowed there yesterday, didn't it? Yeah. Or you're about to get our snow. Yeah, you might be getting our snow next week. I know somebody else in North Carolina. The Hardy Boys are from North Carolina. And yeah, the Hardy Boys are from North Carolina. Do you like the Hardy Boys? They're wrestlers. So, well, I guess I don't even know if you know who they are. I don't know why the fuck I'm talking to you like I know you. Uh-huh. I want to know you though. Do you know who the Hardy Boys are? Oh, good. I love wrestling too. Man, wrestling is so much fun. You know, I've been watching a lot of Juggalo Championship Wrestling. Like, I'm a fucking obsessed with that shit. They just got Vince Russo to start doing their show, and I'm telling you, he's doing such a good job. Yeah. Okay. Re recovery and treatment considerations after a brain injury, a guide for clinical decision making. Okay, here we go. Okay. What isn't there? No, no, Matt, no, Jeff Hardy got addicted to drugs and then he went he went to wrestle a match with Sting and was so drunk and so high that everybody was pissed off at him. No, you're not interrupting me. You were talking to me first. And that's okay because we're getting into shit that I have no idea about. Treatment after brain injury. Oh, God. But I'm hoping maybe I could find out a way to fix my brain without all of these medications. But it turns out that might not be possible. What can we expect recovery to look like after a brain injury? Bitch, it shit don't recover. Are you fucking kidding me? There ain't no recovering. See, I'm up too early. Uh-huh. Recovery depends strongly on whether the professionals classify the injury as mild, moderate, or severe. Mine is severe, apparently. This classification is based on a duration of acute injury characteristics, such as loss of consciousness, post traumatic amnesia, and alteration of consciousness. Okay, maybe it may not be severe. It is important to remember that there are many people who have experienced brain injuries who have gone on to go to success related to their job, school, and personal lives. Yes, which when you have a brain injury, you're pretty much okay. But I know some dudes who have little tiny brain injuries, way less than mine, and they go around and poo and pee on themselves and talk like this because I got brain injury. It's like you're fucking faking it, and then I get in trouble for that. But it's true, they are faking it. Some brain injuries are that bad, but if you can talk and write your name, you're probably not shitting on yourself. Um, in the case of mild brain injury or concussion, I don't have that. Well, maybe we should read that anyway. A complete recovery is often expected. A mild TBI is different than moderate or severe in terms of expectation for recovery. Recovery following experience a single mild TBI is rapid and full in most cases, 1 to 2 weeks. Okay, so and that's another thing that I worry about all the time is because people die from their concussions. Bob Saget, he died from his concussion and he only banged his head. It was weird. And then there was a couple other guys with concussions and they died in the bathroom, which is my biggest fear, for my brain to explode in the bathroom and nobody finds me. That's why I pee with the door open. I give no shits. I don't want to be found dead in the bathroom after like 12 hours. Because I just think that would be so embarrassing. Nikki K died on the toilet. I'm not okay with that. Okay. A concussion, such as those occurring in a military setting, tend to occur within the context of other. How long have I been in recovery? Since 2000. My injury happened in August of 2017. So, and I woke up from the coma the day Tom Petty died, October 2nd, October 2nd, 2017. And I had my last brain surgery Valentine's Day 2018. And I've been recovering since 2018. No, I got out of the hospital in November of 2017. So yeah, since 2017. And really, I did not have a lot of problems at all. Like, the better I'm getting, the more problems I'm having. And it's not even like with myself, it's with other people because I still do inappropriate things at inappropriate times. I talk to strangers. I asked this black guy, he had like 3 feet long dreadlocks. And then I asked him if I could touch his hair. And then I met this other lady at a weed store, and I was with Dustin, but she had a really nice outfit on, and it made her butt look nice. And I told her, "You look so nice." And she said, "I was wondering because I was up all night doing cocaine." I was like, "Well, nice to meet you." Uh, yeah, yeah. I hope you have such a fun day. But I meet the coolest people just talking to strangers. This one time, I met a white supremacist at a weed store in Michigan, and he was a white supremacist. And then I started noticing his tattoos, and I was like, what does all this stuff mean? And he's like, I'm an Odinite. And Dustin said, get the fuck away from that guy. You are going to get him jumped. I said, what do you mean? He's like, that's a white supremacist in a weed store with all black people. Do not get him in trouble. I was like, okay. Yeah, I do all sorts of shit. Yeah. But really, it's not even embarrassing. It's other people's reactions to me that is embarrassing. I'm not embarrassing, but you should see Dustin's face. Oh, he's like, get over here. I'm like, you're what's making life embarrassing. Yeah. And I don't even like, I've had this brain injury for so long. I don't even know why. I'm still trying to search how to fix it because there is no fixing it. But I went off these sedatives. I don't think anybody understands these sedatives and what they are doing to me. I sleep for like 13 hours, and then other days I can only sleep for 6 hours, and then some days I don't even sleep at all. It's crazy. Indeed. Okay. So we're almost done with this. Okay. Do we need to know about that? Okay, we'll do it. Concussions, so such as those occurring in military setting, tend to occur within the context of other factors that predict persistence in behavioral and cognitive problems. Okay, this is what I have. So this is the first thing that they told me. They said you got a brain injury like somebody was shot in the head but was wearing a helmet. I was like, "Oh, that sounds great." So when they said that, like for fucking 3 months, I thought I was gonna have to wear one of those helmets that they put on like brain damaged people, and they wear the helmet. I thought I was gonna have to wear a helmet. Turns out, no. Thank God. Okay. That predict persistence in such as sleep deprivation, emotional stress, physical injuries, and pain. These latter factors may instead be explanatory and cognitive difficulties. Patient education in these cases has shown uh, to be one of the most effective ways to decrease symptoms. What? Concussion, such. What does that even mean? Okay. Concussions, such as those occurring in military, tend to occur within the context of other factors that predict persistent and behavioral and cognitive problems. So, if you do these things to yourself, you get better, such as sleep deprivation, emotional stress, physical. Do you know what this means? Am I supposed to do these things to make my brain better? These latter factors may instead be explanatory and cognitive difficulties. Oh, patient education has been shown to be one of the most effective ways to decrease symptoms. So pretty much you're just pointing shit out to them and like, pay attention to when you act like this and don't act like this. That is what they told me. Uh-huh. Yeah. Your brother has trouble sleeping. Look, that trouble sleeping is no joke, man. Especially like when you're trying to sleep and then you can't, and then your body starts hurting because you can't go to sleep. Okay. Hold on one second. Okay. Um, does he have trouble falling asleep or staying asleep? Because I don't know which is worse. The being able to fall asleep. But that's why I kind of gotta stay up late so I can just go to sleep staying asleep. That is the worst. Yeah, I don't even know how. Actually, I do kind of. He was taking. Oh, they have me on sedatives. I gotta force myself to stay awake past time, or I will not be able to stay asleep. Kind of like what happened today. But if I don't, if I don't wake up this early, then I sleep until like 2 o'clock in the afternoon. And that's never good. Mm. See, the melatonin thing worked for me for a little while, so I had to quit taking it because it stopped working. Okay. Where was I at? Where was I at? Okay, we read this one. Okay. Yep. Okay. Okay. So where are we at? What are? Oh, okay. Okay. I love getting. Really? Well, I am a firecracker, and yesterday, have you heard of this guy called Black Yoda? I think he made me call him, and he was drunk as fuck. Like he put his phone number on my live stream. It was crazy. But I think he was drunk and he wanted to know why God lied to him. And it was the craziest thing. It sounds like something I would do, but somebody did it to me, and I don't know if he was fucking with me or not. Have you ever met him before? Yeah. Okay, this one we were at. All right. Oh, no. Where the fuck are we? Okay. We're right here. Okay. What are other factors that can make recovery easier or more difficult? Here we go. I wonder if they have mean people on here. Mean people make it harder for you. Actually, I bet it mean people make it easier for you to recover. Because I'm telling you, if you don't look injured, people don't think you're injured. And they say that about mental health, but no. When I was mentally ill without brain injuries, I got away with a way lot more. than I do having brain injuries. I can't get away with shit. Yeah. I don't know what to think about that guy. But I think he was just drunk. I think he drunk called me or something. Which I don't mind drinking, but maybe don't call people when you're drunk or have people call you when you're drunk. So, see, this is the thing. Like, they're telling people to go to sleep after they have. Hold on. So, don't think and just go to sleep for a week following a concussion. It will maximize recovery. I mean, I've spent the last 10 years. Oh, well, actually, no, that's a lie because I do nothing but think. So maybe if I learned how to not think, I could fix my brain. That's not a thing that's happening. My brain's never going to be fixed, and I'm never going to be off these sedatives, am I? Man, this is so stupid. I just want to fix my brain. I I just want to fix my brain, and there goes my cup of coffee, and I don't even give a shit. Just just why is it everybody else can fix the things wrong with them, but I can't fix the one thing wrong with me that might make people be nice to me, and then I won't have to live stream just so people be fucking nice to me. Not that I don't mind live streaming. I don't mind live streaming, but I wish it wasn't the only place people were nice to me. You know, the people that are supposed to be nice to me are not nice to me. And the people that I shouldn't even know are nice to me and treat me with some kind of dignity, even though my brain is broken. Just, I hate this so much. I just, I just want my brain better. And it's not even possible to fix my brain. Oh, I've drunk posted before. Yeah, mean people do suck. But it's like they're mean to me for something I can't really fix and I don't even know I'm doing until after I do it. Once I've done it, I know I did it. But then it's like I can't even like say sorry for it because it's already over with. And I really just spilt my coffee everywhere. Oh, this is infuriating. This is way infuriating. Okay. Man. Cognitive and physical rest for the week following a concussion will maximize recovery. So that's why they put me in the coma to help me fix my brain. So they did because I was in a coma for a month. And this is saying just rest for a week. And I had a month. So my brain should be recovered. Why isn't it? What the fuck? Okay. While the questions of how much and what kind of rest are under investigation, it is customary for athletes to refrain from play or military to um, to refrain from duties such as report writing, going on convoys, or performing guard duty within the week following TBI. Following a concussion will maximize recovery, while the questions of how much and what kind of rest. Oh, I already read this. Writing, going, and following the TBI. Individuals should receive plenty of sleep, plenty of sleep during this time. Rest will also protect the individual from subsequent concussion during healing. Temporary symptoms also resolve faster when a person rests. Okay. What are the temporary systems? Because do I have those? Brain injury survivors can feel overwhelmed by their memory problems, but one useful coping strategy has been to isolate each memory problem, make a list, and attack one problem at a time, following a mild TBI. Negative global stable attributions about memory problems, they will never go away, tend to predict system percentage. This is what I told, damn, I don't remember who it was, but I was like, if you keep thinking that, then it's never going to happen. Yeah, like right now with my brain, that shit's never going away. But mm, this says it'll go away if I stop saying that. This is crazy. Abs- ah, abstinence from alcohol and drug use is also likely to improve cognitive efficiency over time. Alcohol has been shown to differentially and negatively affect individuals with TBI. Okay, I could see how the military people end up angry because they end up drunk. Catch you later. Is it time for her? Is it time for Neo? But if it's not Neo, have a great time. I'm going to finish reading this real quick. Oh, okay. No, it's not Neo. Never mind. Okay. 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 What assessment and treatment steps can be considered after a brain injury? Okay. In general, immediately immediate medical attention is recommended where brain injury is suspected. Recovery from most mild brain injuries generally takes a benign course, although monitoring for potential complications such as intracranial bleeding, intracranial breathing, seizures, or worsening of symptoms is recommended in some cases if the brain has been severely injured. That's my brain. The bleeding and the seizures and shit. That's my fucking brain. Monitoring worsening of symptoms is recommended in some cases if the brain has been severely injured. Yeah, that's me. Neurosurgical evaluation or efforts to control uh, control elevated intracranial pressure may be useful. Physical cognitive rest is essential for the week after. Well, we already read all of this. Recovery is different for each person and depends on the nature and severity injury to develop recommendations to promote recovery. Yeah, but if your brain doesn't recover, how the fuck do you do that? How do you recover your brain injury? You know, that would be great. Fuck no. But no, that's not a thing that happens. Okay. Symptom free. Right? When individual with milder injuries, yeah. Okay. Recovery is different for every person and depends on the nature and severity of the injury to develop recommendations to promote recovery. Recovery assessment as a close to the time of the injury as possible. Uh, Here we go. After a brain injury, individuals who experience moderate to severe injuries and potentially a minority of individuals with mild injuries who do not experience system resolution may be considered for rehabilitation. Okay. So that was me at the beginning. That's what I got. I got the rehabilitation. In the case of more severe injuries, rehabilitation, unlike other types of healthcare, rarely provides a cure. They're unable to fix or cure severe brain injury completely. The discussion around the problem, reduction, and compensation rather than cure can be difficult. This is so stupid. Like, seriously stupid. Okay. So, um, okay. Is it this one? Huh. Um, okay. There we go. All right. Okay. So, like, it's coming. I want to fix my brain, but there's no fixing my brain. No matter how many times I look this stuff up, no matter how many times I look this up, no matter how many times people are mean to me, no matter how many times anything, I look up this how to fix my brain, and there's no way to fix my brain. I want to get off all these sedatives, and there's no way to get off all these sedatives. There's not like, um, there's not like a thing, medicine you can take that will do certain things. There's no medicine that you can take that'll just get rid of the symptoms that make everybody treat you some kind of way. And I mean, nobody's really treated me some kind of way in a little bit, but I, 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 I don't know. But I do know that I want to fix my brain, and there's no way to fix my brain. So even if like I, it's a, oh, here we go. Mental health consequences. Depression. I I don't have depression. Except for right now when I'm fucking finding out for the 15th time I can't fix my brain. No matter damn, that tobacco is dry as shit. Anyway, I do this to myself a lot. I go through these things hoping to find something new, something different, a way to stay off the medication. It just anything. And there's nothing. It's like, I don't like the sedatives. Like, really, I don't like the medication at all. But the medication that I'm on is seizure pills first and mental health pills second. So I'm on seizure pills and non seizure pills that are just mental health pills, something called Vraylar. Yeah. But I don't think I have the depression except for when I go to these sites like, "Can I fix my brain?" And they're like, "No." Then I'm, like, super depressed, and I shouldn't be super depressed, but I am super depressed. Anxiety, intense worry fear, panic. I don't have that mostly. PTSD. My doctors say I have that. All of them say I have that. Yeah. Increased mis increased substance abuse. That's why I can't quit smoking cigarettes. This right here is why I can't quit smoking cigarettes. Key aspects of recovery. Invisible head injuries. Damage is microscopic, meaning it may not show up, making diagnosis difficult. No, they saw my diagnosis. Treatment involves a combination of cognitive behavioral therapy and medication to manage symptoms. Hey, Robert, we're not doing the God thing right now. We're trying to do this brain injury thing because I want to fix my brain. But we're finding out for the 15th time I can't fix my brain. I was hoping maybe if I did it on a live stream, it would be different, but it's not. But thank you for your blessings. I appreciate you. Um, okay. Medication, support, behavioral therapy helps manage outbursts while support groups assist with the adjustment of new life challenges. And see, that's where I have the biggest problem going into groups of people with brain injuries because they're faking it. There's no way you can sign your name and shit on yourself at the same time. But then people are like, yes, it is. It's like, no, that's not a thing. If you can sign your name, then you need to get a colostomy bag because I'm not cleaning your shit. You got me fucked up. You got me fucked up because I'm not, that's a thing I'm not doing. Okay. It is important to understand behavioral changes are symptoms of a physical brain injury, not intentional actions by the individual. Yeah, this right here. This right here is what people don't understand because I don't sound injured. I don't look injured. The only time you can tell I'm injured is when I'm walking because, I'm numb on one side. Well, okay, not numb, atrophied in one side. My whole body weighs 1,000 pounds. Okay. Mental health consequences of traumatic brain injury. Let's see what this one is. Ooh, is a big one. Is big words. Big words. Okay, shut up. Okay. Here we go. A TBI is associated with a host of psychiatric and neurobehavioral problems as mortality rates have declined for severe TBI. Attention has turned to the cognitive, affective, and behavioral sequelae of injuries across the severity spectrum, which are often more dis- disabling than residual physical effects. Moderate and severe TBI can cause personality changes, including impulsivity, severe irritability, affective instability, and apathy. I have that apathy. That means when you don't really feel anything. It's my therapist said it's the same kind of thing that people when they cut themselves, that's what they're talking about. They don't feel anything. It's like, have fun not feeling anything, and it's not even your own fault that you can't feel anything. Actually, I suppose people who cut themselves, it's not them doing it either, is it? So I can't really talk shit, I guess. Okay. So behavioral problems, uh, often. Okay. It can cause personality changes, including impulsivity, severe irritability, affective instability, and apathy. Mild TBI, once considered a largely benign phenomenon, is known to be associated with a range of affective symptoms, with suicidality. I think that is a self deletion thing. You're deleting yourself from God's YouTube. And with worsening or new onset of several psychiatric disorders. Okay, here we go. Um, Including PTSD and major depressive disorder, which they say I have, but I don't have that. Repetitive head impacts, often in athletic contexts, are now believed to be associated with a number of emotional and behavior sequelae. The nature and hi, Sage, how are you? I'm sorry. I cannot see my chat. I'm having such a hard time. Okay. Let me have such a not a hard time over here. I'm sorry. Good morning. Yeah. Uh that that is how I got part of my brain injury, the most of it came from uh pretty much being curb stomped into the dirt and then jumped on a lot and then had like my ribs were broken, my spleen was ruptured, my arm is broken, I got tracheotomy thing, whole bunch of crazy shit happened. And I'm one of these severe cases. And once again, I've probably done this 15 times. Was my first time on a live stream doing it. I was hoping something would be different, but nothing is different. It's the same. There's no fixing my brain. Like I want to fix my brain and there's no fixing my brain. And like I keep looking. Like maybe there's a way to do it without all this medication. But nope. Every time I look it up, it can only be fixed with medication. And it's like, yeah, but I take so much medication though, and it's not working. And I wish there was like a uh one of those home remedies or something. Like if you take this every day, it'll fix your brain. If you take this every day, it'll calm down the symptoms and you won't be so embarrassing in public. And then maybe people won't be mean to you. You know, like, isn't there something? It's just something. Because when you don't look injured, you don't sound injured. People forget you're injured. And they just make things hard on you on purpose. And I want to fix my brain so I can just be regular. I just want to be regular. I had accident. Oh shit. So yeah, we were just reading about that soldier TBI stuff. That is some complicated shit. That soldier stuff is way complicated. That 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 shouldn't be alive. I totally know that feeling, dude. And if it wasn't for Jesus, I wouldn't even be here. So I totally know what you mean. But thank God that you're here because I see you all over the place giving people positive things. Strangled you until you blacked out. Oh my God. That has got to be something, man. Like I wouldn't even know what to do. Yes. Well, dude, I'm glad. I haven't got angry enough to strangle. No, that's not true. Well, not to strangle anybody, but I got pissed off enough at my grown ass son that I punched him in the arm. But he's so tough. He's like, that didn't even hurt. I'm like, that's because my arms don't work. Yeah, that, but he said something to me. You're not my mom. And I said, yes, I am. And I punched him in the arm and said, I don't like it either. Yeah, that was a thing that happened. Oh, you were sleeping? Oh, shit. Damn, girl. Then, yeah, then maybe he didn't have the soldier thing wrong with his brain. Maybe he was really just fucked up. Yeah, I bet. See, men are so, they say women are gold diggers, but men are grave diggers for some gold. Look, not making light of your situation, but men are way more deadly when it comes to money than women. Women suck at being deadly for money, but men, yeah, that is the thing to do. Don't say nothing, because you know what? Only one man can keep a secret. So if you're keeping a secret, you keep that secret and don't tell nobody. But then it's the, oh, wait, not having nowhere to go shit. Yeah. Well, hindsight is everybody's superpower. It's we're all Captain Hindsight because I could say the same thing. Hindsight, you shouldn't move to Southwest Detroit by yourself. Hindsight. My shit was about a decade ago also, and I still haven't figured out how to fix it. But did you to a $250,000 home to go to where? The ghetto. Yeah, I can imagine. Is it that Chris Kyle guy? Because he was a really good sniper, and I think I'm related to him. Yeah, the first place that he might look that wouldn't tell him. Never mind. Hindsight. Hindsight. But if you find another lady in that situation, the women's shelter. But then you got to be careful with that because the women always go back. I am living proof of that. That women always go back. Men are so swift with their meat until they get you. And then it's all over. Yep. That's why, no offense, I don't help females, especially out of domestic violence situations. It's like, nope, nope, not even fucking with it. Because you'll be with them next week anyway, so you might as well not waste my fucking time. Like, it takes a lot to convince me that you're not gonna go back because it's like, yeah, I'll get you out of this situation, but when you go back, do not ever call me again. Yep. And I do know it's dangerous to leave women in those situations, but unless they're ready to go, they're not really gonna go. They just want attention from somebody that's not punching them in the face. But they'll gladly go back to that getting punched in the face if it means saving them from being uncomfortable. Women have to, if a woman is ready to go, she's not going to tell anybody and she's just going to go. Sometimes they have to be rescued out of situations, but 9 times out of 10, they're going back. So why waste your time? The military did not help you, they helped him. Well, it's because the military needs people right now. That's why they want to keep as many soldiers as they can, especially if he's a good soldier. There's a cat at my door. Hold on. I'm coming, asshole. I know, I hear you. Yeah, I know. I know. I know. Oh, you're so cool. The baby's so cool. It's a cool baby. It's so cool. Oh, say hi. Okay, are you there? Okay, he was a very good soldier, just not husband. That the military don't need husbands; they need soldiers. But you need a new husband. I would say I need a new husband, but who else is going to tolerate me? Oh, that needs. Let's get to. Well, hold on. They they hit us in the back. Wait a minute. Can you explain that to me? Because A, I'm retarded, and B, I have no idea about the military. Well, except for I know they need soldiers and they will protect their own because they need soldiers. It's not like back in the day when the army looked down on that kind of shit. It's different. You. So, also, um, do you wanna come up here? No? Okay. She just wants to chirp at me. Chirp, chirp. Come on. You're so little. Let me pick you up, crazy. Okay, fine. Also, at rabbit hole goes further. I'm not going to say. God is amazing all the time. What kind of, like, did you end up getting a brain injury? Sorry, my cat's chirping at me. I don't know if you can hear that or not. Oh, I like that sticker. I just added that to my favorite sticker. Some women. Yeah, some some of them never get to live, which I think is why they say the survivor thing is because some don't live and some do live, and like survivor's guilt. They say a lot of domestic violence women have survivor's guilt, and that's why they try to help other women in similar situations. But women hardly leave, which is the problem. And I think with calling women survivors is because a lot of the women that are in that situation, they do leave and they do go back and they do get dead. It it's kind of one of those personal responsibility things. You're not a survivor because somebody chose stupid. You are a warrior because you did warrior things and you didn't go backward. Oh, yeah. Well, at least you got away again. You know what I mean? Men are tricksy like that, man. You never know how sick they are until, yeah, you never know until, right, he's tricking you back into. uh, Do you want to take my medicine with me real quick? All right. I gotta step away one more time. I gotta grab my pill. Pills, 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 pills. Okay. I take 3 of these in the morning and all the rest of them at nighttime. There's so many fucking pills in here. Look at this. All of these pills. Pills, 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 pills. Hey, General Piggy. Right. It's not just men. Women are just as bad. Yeah. And at one time, I would have probably been considered uh abusive. Well, verbally abusive because I like to yell a lot. See, this is why I don't want to take all these pills. So I'm legitimately wanting to fix my brain, and there's no way to fix it. Well, he is retired. He's yeah. Sage, you are really tough. I mean, especially if you didn't get brain injuries from that, you were super tough because I think most people, including myself, would be, uh, hey, Miss Muddy, you're here. I see, I can't read both my chats at once. Having such a hard time. Okay, let's just do this way. No. Okay, here I am. Here I go again on my own. Going down the only road I've ever known. Like a drifter, I was born to walk alone. That's my brain injury song. Miss Muddy, are you still here? Yes, I don't even know why like, that song makes my brain feel better. Because I just picture my brain walking through a desert holding its thumb out singing that song. Like, don't ask me. I think of the stupidest things. Is General Weeds for the W indeed, General Piggy. But that's actually how we got started on this, General Piggy, because I was trying to uh fix my brain. And I've looked up this same shit like 15 times, and it always comes down to the same thing. And I always melt down over the same thing. But it's it's frustrating that I can't figure out, like, is there homeopathic medicine? I'll fucking take it every day. Like, and the CBD, they say CBD for seizures. It does not work, or at least for my seizures, it doesn't work. Yeah, what's your song? Do you have one that your brain goes like hitchhiking? Listen to it while it's hitchhiking. Yeah. Oh, I'd appreciate that because I, because I did send my neurologist medicine, a message and asked her, like, I want to get rid of all these pills. And she said, well, we'll think about changing your pills or rearranging your pills, but you still have to take your medicine. What is your song today? I should stop asking people what their songs are this early in the morning. They should. Yeah, yeah, little bits of it, but remember we read some of that stuff doesn't show up in the MRI. Remember? Maybe you weren't here for that. But it says small microscopic injuries will not show up in the uh and they don't show up in the CTs or MRIs because they're too small. Not saying your strangulation was small, but maybe that's why it didn't show up. Pat Benatar, that's a good one. That's a real strong female. And did Miss Muddy never came back? Miss Muddy. Here we go again. Here, come on. Do you guys here? Do you guys want to meet my mountain cat? It's Blue, the mountain cat. She thinks she's a newborn. Meow, meow, meow. Listen, come. I know, I know. Go this way. Go. Go that way. That way. That was Blue, my blue mountain cat with no tail. Sometimes it won't, or well, it does, but they can find it. Yeah. Well, I know that in 2009, I got beat up pretty gnarly, and my cousin made me go to the hospital. And I had a thing in the back of my brain. It was it was a little clump of blood cells or veins, and they grew into a giant blood clot when I got kicked in the back of my or hit in the back of my head. But that's been there since I was a child, and it didn't show up on any of my brain scans until 2009. And then the doctor didn't even tell me about it. And then they found it in 2017 when it like was getting ready to explode. It was crazy. I'll be hopping around. See you around. Thank you for streaming. Yes. Yes, no problem. Have a great day. General Piggy, are you still here? Because I think I got a few more minutes that uh, I'm going to. Oh, no, you don't have to listen. No, you go do what you got to do. I'm going to keep, well, I don't even, I think, uh, yeah, I think I might be getting off here because the man's about to be waking up soon anyway. Hold on, because BS allopathic are always in the right. Huh, yeah. I love you, Sage. I hope you have a great day. And thank you for stopping in. Actually made me feel a lot better. So thank you. Okay. So now what are we doing? Okay. So I guess with all that being said, let's we need to make some breakfast. Maybe I'll make one of those breakfast pot pies. Those things are so good. The biscuit and gravy pot pie. That's light. Anyway, maybe we should go make breakfast. Maybe some toast. Yeah, we're gonna go make breakfast. General Piggy, are you still here or no? Do you want to go make biscuits and gravy with me? Well, biscuits and gravy Popeye. That's a good time. And I love you, Miss Muddy. I just want you to know that I don't know if you can hear me or not. I should start singing Pink Floyd to you. Hello, hello, hello. Is anybody out there? I need my Miss Muddy. Is there anybody home? Nope, she's not. She's still driving to work. Okay. Well, oh, Severe's up. Okay. Let's go over to Severe's. All right. So, now how do I do this? Set raid to go to Severe's. Okay. You have set up a raid. Okay. We're going over to Severe. So, I love you guys, and I'll see you over there. Have a great day.